Hi, I'm Randy Neiswonger, CEO of Community Hospital. Welcome to this edition of Community Beat. Today I have Tracy. Tracy, good to see you.
Thank you.
Can you tell the viewing audience a little bit about what you do here for Community Hospital?
Yes, absolutely. So I am the nurse manager of the NICU and pediatric floor.
So we actually have two NICUs. We have a neuroscience NICU, but
Yes.
you take care of the other end of the spectrum NICU, as in
Neonatology.
neonatology. So define neonatology for us. What do you see in the NICU?
Absolutely. So what we see in the NICU right now is basically any baby that's could be 22 weeks and over, up to full term or after full term. We admit any condition that we need to. We also admit babies from St. Catherine Hospital. So if they need a baby that needs extra support or care, we have a transport team that will go over and help get care for that baby and bring the baby back over here. We also do that for our other sister hospital, St. Mary's. They do have a level 2 NICU, so they do have the smaller babies, 32 weeks and up, they care for over there. So we can go over there and grab those babies if we need to, get them stabilized, get them back here, and provide the very best care that we can.
So 22 weeks, 32 weeks, that's very premature to deliver.
Extremely premature. We do a lot of extra tender, loving care for these babies as much as we can. Some of our babies have to go to a higher level of care where they would need surgical interventions, but we do everything that we can here within our scope.
I bet it's a pretty big celebration when you're able to discharge a baby from this NICU.
I'm glad that you said that. So yes, we have had quite a few of nano preemies that have been born over the 22-week mark. We have thrown a couple of graduation ceremonies where we kind of line the halls and we celebrate them as they leave. These milestones are huge and they need to be celebrated on all of our NICU babies. But
celebration.
Well, it's so much fun. I mean, we have balloons and we're cheering and we're playing graduation music. Honestly, it is probably the best feeling.
And probably the most important graduation that they will ever have.
Absolutely. And you know, we try to support our parents and try to make sure that they know we're here for them.
Sure, of course.
Yeah.
So when they graduate, they grow up.
They do.
And I understand there's a unique event that's coming up that we're
Very
celebrating.
unique event, and I'm very excited about this one as well. So we are offering a NICU reunion for all of our graduates. We are celebrating not just the graduates, but also their parents and their families that have put so much time and energy into these babies. So yes, September 13th, we're super excited. We are going to have all kinds of fun things. We're going to have some food for the kids. We're going to have music. We're going to have games. I do believe I heard that Bluey and maybe his friends may be showing up as well. So we're very excited.
So I understand that you have over 240 registrants already?
Yes.
Family and graduates, as you like to term
Graduates, families, yes. I have an 18-year-old that's going to return who's been here as well. So we have the older kids that are coming back, and again, we want to celebrate all of this.
Yes.
So as much as we can do to welcome them all in, we want to do it.
So how do they register? If they were in the community as a graduate and they want to come back, how do they register for this? How do they find out the details?
There's a QR code that you can scan, and that will get you in to register for our event.
How fun.
I know, I'm so excited.
Well, thank you very much for everything you do
Of
each and every
course,
day.
thank you.
Thank you guys for tuning in. We'll see you guys next time on Community Beat.